Good morning.
Good morning.
I'm Krizia Cari-an, second year medical student from school Phinma. Can I have your name and age, please?
Randy, 36.
Sir Randy, I will be doing examination for your musculoskeletal system. Is that okay with you?
Sure.
Okay, now I will be doing the assessment for temporal mandibular joint. So first, I will do palpation to the facial muscles, the masseter, the temporal muscle, and the pterygoid muscle. This exam is done in order to assess swelling, tenderness in the muscles, decreased range of motion of TMJ, and also to locate if there's any palpable crepitus or clicks during palpation. I will be palpating here, the left side, right side, which is more tender.
Same.
The same. Next is I will be palpating the masseter muscle and note if there's any change in muscle tone. Can you clench, please? Okay. Any tenderness? Next, I will be assessing the TMJ is located in the anterior part of the tragus of the ear. Here. Is there any tenderness? Right side. Can you open your mouth, sir? So there's no presence of any tenderness. Next one is to assess the pterygoid muscles, which I will be using a hand glove because I will be palpating it internally between tonsillar pillars of the mandible. Sir, can you open your mouth, please? So here. Other side, please, sir. Thank you. So there's no any tenderness. Next is I will be assessing the range of motion of the muscles for mastication. Sir, can you open your mouth? Close. Can you protrude your jaw? Retract. Okay. Can you move your jaw from side to side? Thank you. So the next exam is to assess the shoulder of our patient. So now I will be doing an inspection. So I will be noting for any swelling, deformity, muscle atrophy, or any fasciculations, or any abnormal positioning of this shoulder. And also I will be looking for swelling of the joints, and I will be noting the color of the skin, the alterations, and unusual body contours. And so next, for the shoulder range of motion, okay, for deflection, sir, can you raise your hand in front of you and overhead, please? Okay, next, sir, for the extension, can you raise your arm behind you, please? For abduction, can you raise your hand at the side and overhead, please? Okay. Okay, for adduction, can you cross your arm in front of your body? Thank you. For internal rotation, can you put your hand at the back, reaching your shoulder blades, please? Okay. So I will be identifying the highest midline of the spinous process in which my patient could reach here. So he's in the T7. Okay, the other side, please. Okay, my patient reached higher in this side compared to the other side. Okay, thank you, sir. For the external rotation, can you raise your arm to the shoulder level, bend your elbow, and rotate your forearm toward the ceiling, please? Okay. So now I will be doing the external rotation resistance test. This one is in order to assess the infraspinatus muscle and also the deltoid muscle. So sir, can you raise your hand like this, and then your thumb, can you rotate your arms outward? I will be resisting it. Okay. So for the positive, if there's any decreased mobility and pain during the movement. Other one. Any pain? So next examination that I will be doing is the anti-can test. which I will be asking the patient to lift your arm in 90 degrees, please. Okay, do the V shape, and then can you rotate your arm internally? I will be pushing your arms downward, and you should resist it. Okay. Thank you. So for the positive, I should note weakness or any pain in the affected arm. Now I will be doing the examination of the elbow. So I will be palpating the olecranon process and note any tenderness. Normally, the synovium and the bursa are non-palpable, and I will be noting if there's any displacement. Sir, can you stand up your elbow, please? Cranial process and the epicondyles. Any tenderness. Okay, so there's no. Other side, please. So next is for the range of motion and maneuvers. Okay, first for the range of motion. Sir, for the flexion, can you bend your elbow? This test is used to assess for the biceps brachii, brachialis muscles, and brachioradialis muscle. Next is extension. Sir, can you straighten your elbow, please? Okay. This is for the assessment of triceps brachii and anoconeus muscle. Next is for the supination. So can you turn your palms up like this, as if you're carrying a bow? This is used for assessment of biceps brachii and spinator muscle. Next is pronation. So can you turn your palms down? Thank you. And this one is for the pronator muscles. So next is for the assessment of the wrist and hands. First, I'm going to palpate the wrist joints. Sir, can you put your hand here? So next, we'll be palpating the anatomical snuff box. Can you do this, sir, please? I'm palpating the MCP joints. Okay. Number one. Any pain? Any pain? Okay, for the range of motion, so we'll be doing flexion, extension, adduction, and abduction. Arms, please. With palms down, point your fingers towards the floor, like this. Okay, thank you. So next one is extension. Palms down again. Point your fingers towards the ceiling. Thank you. Okay, next is adduction or radial deviation. Bring your fingers towards the midline, and abduction away from the midline. Away from the midline. Okay, thank you. Okay, next is for the hand grip strength. Can you grasp my finger, please? You're gonna be pulling my finger while I'm resisting it, okay? So next is the test for carpal tunnel syndrome. Okay, now for abduction test, can you put your hand up, straighten your thumb, and then I will be pushing downward your thumb, and you should resist it, okay? Okay, thank you. Okay, for the next assessment that I will be doing is a penile sign. In this one, I will be slightly tap the carpal tunnel in order to assess the median nerve. Next one is for assessing the distribution of the median nerves. I will be slightly tapping the index finger up to the elbow. Any pain or any tingling sensation? Next is the Fallon sign. Can you lift your elbow at the side, facing your dorsum of your hands at the center, like this? Yes, and put it at the center of your chest.
Do it for 1 minute. Okay.
For positive Phelan sign, so there's feeling of sensation or tingling sensation or paresthesia in our patient's thumb, index finger, middle finger, and the half of the ring finger. So is there any sensation that you feel, sir? Okay, sir. Okay, for the next assessment that I will be doing is for the spine. So first, I'm going to inspect my patient. I will be checking or inspect the cervical, thoracic, and lumbar curves of my patient here from behind. So I'm gonna be inspecting the upright spinal column of my patient, and then inspect the alignment of the shoulders and iliac crest, and also the skin crease below the buttocks. Next is to assess the range motion of the spine. So I will be asking my patient to do the flexion. Sir, can you bend forward and try to touch your toes, please? Okay, thank you. For extension, sir, can you turn back? Sir, can you bend backward as far as possible? Okay. Now I will be doing the rotation. Okay, can you rotate from side to side? So I'll be supporting you here. Other one. Okay, thank you. And now I will be doing the lateral bending. So, okay, sir, can you bend to the side as if you're reaching your toe? Another one, please. Okay, thank you. So the next test that I will be doing is for the hip assessment or the range of motion of the hips, in which I will be asking my patient to do several movements here. The first exam is flexion, in which assess the function of the iliopsoas muscle. Okay, sir, can you bend your knees up to your chest and pull it against the abdomen? Okay, the other side, please. So the next assessment that I will be doing is the internal rotation and external rotation of the hip. For internal rotation, I'll be moving the foot and the ankle away from the midline. External rotation is across the midline. The other side, please. Bend your knee up. Internal rotation, external rotation. So the next one is the abduction and adduction. Sir, can you lift your leg, please? I'll be moving the leg to the midline. This is adduction. Outward is abduction. Your leg, please. Adduction. Abduction. So the next maneuver that I will be doing is the extension of the hip. So I already asked my patient to face down here. So I will be lifting the leg of my patient with my hand supporting the iliac spine. Down. Thank you. So now I will be doing knee examination. First, I will be doing palpation on suprapatellar pouch, the prepatellar bursa, and the anserine bursa. And in this, I will note swelling and thickening. So I will be palpating also the bursa of the patella in order to check if there's any swelling or bugginess. Check it. Downward to the side. Video. So the next test is for the knee joint effusion. So this following tests are being used in order to detect any fluid that is present in the knee. The first test that I will be doing is the bulge sign. I already asked my patient to lay in a supine position. So now I will be applying pressure to the suprapatellar pouch. Stroke it downwards. And then in the medial aspect of the knee, I will push it laterally if there's any fluid that will go through, and slightly stroke it. If bulge sign is positive, there's presence of fluid in the medial side of the knee. So the next test for knee effusion is the balloon sign, and it is 4 major effusions. So in this one, I'm going to palpate for fluid ejected and note for ballooning into the spaces. The positive result is a palpable fluid wave. So now I'm gonna compress the suprapatellar pouch into the femur here and check if there's ejection of fluid or ballooning. There's none, it's negative. Other side, there's none. So next maneuver is the ballooning the patella for major effusions, but I already added extra pillow for support here. For positive ballooning the patella result, there's a presence of palpable fluid wave, or the patella is floating when I slightly touch it. So again, I will be pressing the suprapatellar pouch against the femur. The patella will float if there's increased synovial fluid, but there is none, so it's negative. So the next maneuver that I will be doing is the McMurray's test, done in order to determine meniscus damage. Fully flexed, and I will be rotating the tibia medially, and do extension a couple of times. You're doing it in different angles. A palpable click or pop along the medial or lateral joint line is positive test for McMurray. So the next maneuver that I will be doing is the abduction or valgus stress test. So this maneuver is intended for medial collateral ligament injuries, and the positive result for this is pain or a gap in the medial joint line. So the knee is slightly flexed in 30-degree angle. So I'll be putting my hand here, the femur, and the other hand is just above posterior ankle. Okay, so I will be externally rotating the tibia and perform abduction in the knee joint, putting stress to the medial collateral ligament. So any pain or gap in the medial joint is a positive result. So the next maneuver that I will be doing is adduction or the varus stress test. So this one is indicated for lateral collateral ligament injuries. Positive result is the same as the valgus test, which is pain or gap, but in the lateral joint line. But this one, I will be rotating the tibia into the lateral collateral joint. I'll put my hand here to fixate the femur, and the other one is in the lower leg. So I will adduct. So I would put stress on the lateral collateral ligament. Other side. So the next maneuver that I will be doing is the anterior drawer test. So this one is indicated for anterior cruciate ligament rupture. Positive drawer test if there's presence of forward jerk showing the contours of the upper tibia. So to perform, so I have to bring my patient's hip into 45 degrees and the knee into 90 degrees of flexion. My thumb here, and try to move, I will try to move the tibia anteriorly in an explosive movement. Okay, the next maneuver that I will be doing is the Lachman test. So it's also indicated for anterior cruciate ligament, and most especially it is to detect significant forward excursion or tear in the ACL ligament. I will put my other hand here to fixate the femur, while the other hand is used to bring the tibia into slight external rotation and then translate it. So the next maneuver that I will be doing is the posterior drawer sign, and it is indicated for posterior cruciate ligament injuries. If it's positive posterior drawer sign, the proximal tibia falls back and have his knees flexed 45 degrees. And I will be pushing back explosively. For the last test that I will be doing is the range motion of ankle and foot. First is ankle flexion. So I will have my patient to, sir, can you point your foot toward the floor, please? Okay. And for ankle extension, point your foot toward the ceiling, please. Next is inversion. Can you bend your heel inward, please? Okay. And for eversion, bend your heel outward, please. So pain during movements of the ankle and foot helps to localize possible arthritis. And for today's musculoskeletal examination, our patient, Rondi, 36 years old, has a full range of motion in both upper and lower extremities, and there's no evidence of swelling or any deformity. Overall, this is a normal physical examination.